The transition from the old EMS system to the new EMS system will be 17 ambulances on the road on a daily basis with approximately 15 quick response vehicles, which we refer to as QRVs. Physical QRV, the quick response vehicle that you'll see respond to an emergency when you call 911, will be one of two colors. We have a couple red ones that are based at local fire departments, and then this paint scheme is the one that you will see the most of. The previous contracted system, at its busiest time during the day, had 17 EMS units and 5 quick response vehicles in the system. The new system has the same 17 ambulances, but we've upped the number of quick response vehicles to approximately 15 per day at the busiest times. These QRVs and these ambulances are not co-based in the same stations. We tried to spread them out a little bit better to give better overall coverage to Anderson County. You call 911 for an emergency. When they answer the phone, our dispatchers will ask you a series of questions that we call EMDing. During this series of questions, they will determine whether you need they prioritize the call, whether you need an ambulance with no lights and sirens or an ambulance with lights and sirens. As they go through their questions, they determine also at that point if a quick response vehicle needs to be sent along with that ambulance. Of the 17 ambulances that we're going to have on a daily basis, the majority of those are going to be staffed with an emergency medical technician and then another emergency medical technician. The paramedics will be, lack of a better term, reserved for true medical emergencies. They'll be on the quick response vehicles and will only respond to the higher acuity medical calls. Our goal with this, having the EMS coverage more spaced out throughout Anderson County, is to have a trained medical professional on scene quicker than what our current response times are. If you're actually the person dialing 911, you should really see no difference in the 911 services you receive, other than some instances, instead of just having one ambulance, you may have one ambulance and a QRV respond to it. Majority of the quick response vehicles are housing with local fire departments, in cooperation with local fire departments to provide a little bit better coverage for those areas that they serve. The transport ambulances, I'd say maybe 70% of those are housed with local fire departments, and then another 30% of their locations are private stations. We measure our response times by a national percentage, which is having medical trained personnel on scene of a medical emergency in 9 minutes and 59 seconds, 90% of the time. That is a standard that we strive for. We check it every day, we check it weekly, and we check it monthly to make sure it falls in line.